House District 16, which includes Corvallis and Philomath. Can everybody hear me in the back? Is the amplification okay? Great. So thank you for coming out tonight for an opportunity to have a conversation about where healthcare is going in the state of Oregon. I'm really grateful that all of the members of our panel were willing to come tonight and that all of you were willing to come. Just as out of curiosity, for how many of you is this the first time you have ever been to a forum about healthcare in Benton County? First time. Very good. That's comments from each of our panelists, and then we'll move on to those questions. But we have with us today Dr. Bruce Goldberg, who is the director of the Oregon Health Network. Also something that our local community can be very proud of as we move into healthcare transformation, being one of the first communities in the state to have a CCO up and running. We're now a couple of months into this, and that's one of the reasons we scheduled this for November instead of September, so that we probably will have more questions and experience in that process. We have Kim Whitley, who is the Chief Operating Officer of Intercommunity Health Network. We have Charlie Fountain, Charlie, from the Benton County Health Department, and Mitch Anderson from the Benton County Health Department. So,
thank you. So the health insurance exchanges are an important piece of federal health reform. And as Bruce mentioned, it's really about making health coverage more accessible to folks. And in Oregon, our health insurance exchange is called Cover Oregon. We actually just announced our new name last month in October. Basically what the Affordable Care Act and federal health reform do is they give the states the option of developing their own exchange, or they can use a federal health insurance exchange. And so in Oregon, we've actually been talking for many, many years about the idea of an exchange. And so the legislature, governor, thought it was very important to develop our own exchange here in Oregon. And it had been in the works for many years, but what the federal law does is actually give us the funding to get it started. And so we're totally federally funded in the startup phase, and then once we're operating, we'll be self-sustaining.
Part that public health plays in the CCO plans, and start with the legislation. And in current legislation, public health gets some mention, but not much. Most of what is addressed there is CCOs coordinate with public health for assessing a population. That's very important to know precisely what's going on, what health assets there are, what health problems there are. In our area, there's significant differences across our 3 counties and region to region within each of those 3 counties. And so that's work that all 3 public health departments are doing currently, and sharing those findings. Benton County's health assessment will be released to the public this week. Our population, not a select group of this insurance plan, that insurance plan, Medicaid, private. We really are about lifting all boats. If you're familiar with the triple aim, public health has a bullseye on the middle aim, improving the health of the entire population. And that's really where we live and what we do. And we do that primarily through prevention.